My name's Dr. Sanjay Tricker. This is Dr. Zoya Diwan of Trick One Aesthetics Mayfair. And today we're going to be talking about all non-surgical option treatments for the neck.
Many patients come into clinic bothered by crepiness in the neck or sagging when they turn their neck from side to side, vertical lines or that turkey neck, horizontal deep lines, folds, sagginess, excess skin, or too much fat under the chin. There are so many different issues that patients come in specifically for the neck region, and we're going to break down all the treatment options for this area.
So starting off with the most common one, let's talk a little bit about sagging and crepiness of skin in the neck.
So yeah, that's a really common concern, and generally we see patients 45 plus coming in with this concern, and males, females alike. One of the key things is that you can actually prevent this by really utilizing your skincare on your neck too. So many people will just put their skincare on their face and forget about their neck, but the neck is just as exposed to the environment, sun, etc. as the face is. So when you're using your SPF, always just make sure you get it all the way down onto the neck as well. So in terms of crepiness and sagginess, there are a number of different treatment options, but one of my favorite treatments for this area will be a biostimulator called Sculptra. So Sculptra is poly-L-lactic acid, and this is used to really stimulate loads and loads of collagen, 66% more than all other types of injectables out there, but it also adds a little bit of tightness, tiny bit of volume, and a bit more firmness. This is just remarkable because you get such an improvement in the quality of the skin. It's prolonged for a good 2 years as well. It's a really good way of banking that collagen, but it will provide those people with that sagging skin a bit more tightness, firmness, and volume. What other treatments do you think are good for this?
So I'd say Sculptra is probably going to be most effective for sagging, but then if we don't have that much sagging, but it's more the first signs, it's more about early prevention or trying to treat the first signs of crepiness in the neck, then injectable skin boosters are going to be a really good option. So whether it's Profilo, I mean that's got really high concentration of hyaluronic acid, and that's going to really improve skin tightness, quality, remodeling of the skin. Whether it's Redensity 1, it's a bit similar, but that does a bit more for texture of skin, and in certain patients that might be a bit better. Or even an option like polynucleotides could be a good option for skin elasticity.
Yeah, polynucleotides is good. Yeah, polynucleotides I think is a good option because what that is ultra purified fractionated bits of DNA, and that's going to go and sit in the skin and not only stimulate soft tissue production, so you get a little bit more fullness in the neck, but it's also going to signal to your skin cells themselves at the cellular level and DNA level to produce more collagen, elastin, and hyaluronic acid. So that's more of a long-term plan and something that is going to be preventative too. So I think treatments like the skin booster side, yes, it's great as a treatment, but I think it's actually really more remarkable as a preventative strategy.
So far we've kind of summarised some of the main treatments that are going to be about skin quality. So Sculptra, Profilo, Redensity 1, polynucleotides, even preventative skincare. What about something like turkey neck?
I hate that word. I mean, it's so rude.
I know,
it
sounds nasty when you, it sounds, not the best phrase, but it's so common.
I'm sure Janet's going to put up a picture of a turkey over our faces or something.
But patients say it. They say, oh, I hate my turkey neck, I hate my turkey neck.
Yeah, they do, but I think like we need to change the language around it. But anyway, I feel like vertical neck bands isn't as catchy.
Vertical necklines, platysmal bands.
I just don't think it's as catchy.
Call it what it is, fine.
Right, so these vertical lines or turkey neck is essentially on a bit of a spectrum. So everyone starts getting them from, a younger age, depending on how active your neck muscles are. Like I get them a little bit on one side, like look.
You show it off?
Yeah, I'm trying.
I can't do it.
Here. He doesn't have any, I mean,
some
whatever.
people, when they go, they get these big bands that appear kind of along here, here, and here, and here.
Yeah, so those are completely normal, but what happens over time is that they can become a little bit more static because these fibrous bands, they develop in this sheet of a muscle called your platysma, and they get bigger and bigger and bigger with age to the point that then they start staying there when you're not really utilizing the muscle, and at that point you start sort of seeing those lines are just there, like making the neck seem a little bit more anteriorly projecting or coming forward basically, so or on the sides too. And what this can actually do is pull down on the lower part of the face too. So people will start saying my face looks really aged, or I don't really like my neck, I'm constantly wearing polo necks, etc. But actually this can be really well targeted by toxin or neuromodulator or Botox.
So the reason for that is we're not focusing on skin quality like with the other ones. This is more to do with the strong muscle that we're trying to relax.
So the Botox just relaxes the muscle. It can last for up to 4 to 6 months. It takes about 2 weeks for it to fully work, and it completely just relaxes it. And you need quite a high dose in this area because it's a large muscle, and sometimes the bands can be really quite fibrous, and honestly the results are incredible. It'll also help tighten the jaw as well, because where those fibrous bands have been pulling slightly, it just takes the edge off and relaxes it slightly.
When we look at the history of how this treatment's been marketed, it's had so many different names, starting from neck Botox, the Nefertiti neck lift, Nefertiti facelift, non-surgical facelift. People call this treatment on its own a non-surgical facelift. That's a big stretch, but I have seen that done before. But they're all doing the same thing. They're all treating the platysma to relax the muscle to improve the vertical lines along the neck. So we've spoken about the vertical lines. What about horizontal lines?
Right, so these are more indentations, so actually almost wrinkles across the neck, like bands this way, more horizontally. And we're seeing quite a large amount of these in more recent years. That's because, you know, the tech neck almost. People are looking down on their phones, down on their laptops, and also coupled with not really using preventative skincare so much on their neck. All of that is leading to more horizontal lines in the neck. So what you can do for this is prevention, so with your skincare that we discussed earlier. But I think a really good option for this is a combination of skin boosters, so hyaluronic acid based skin boosters. My favorite for this region would be Redensity 1. It's a really good product. It will just ultra purified hyaluronic acid injected into the lines, and it will just really stimulate loads of hyaluronic acid of your own skin, plus collagen, plus elastin, just giving it that sort of firmness back. But coupled with that, depending on how deep your lines are, in some patients I'll put a really small amount of a very, 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 very thin filler that just helps improve the volume loss that you're getting in that region too. And together with the skin booster, it's a dream combination.
I think it's worth saying, a lot of people think at this point, oh, the idea of injections in the neck, it sounds really scary and dangerous.
Oh, no.
But actually, neck's probably one of the least painful treatments to receive. And from my point of view, I don't know how you feel, but when I'm treating the neck is probably when I'm most relaxed, because it's probably the easiest procedure to do, in the sense we're just staying really, really close to the skin. When we're treating things like laxity, we're really near the surface. There isn't too much. It's not a case where we're going deeper and there's lots of dangerous structures in the area. It's really, really close to the skin.
And lastly, what about patients who have issues with, say, heaviness or a double chin or jowling into their neck, or just the texture of their skin not being sort of optimal, but not really too many of the lines?
Yeah, now we're talking about energy-based medical devices. So something like Morpheus 8 is probably one of the more famous ones. And that one actually helps remodel the entire jawline by focusing on the fat under the chin in this region here. So what this treatment does is two things. It, number one, targets the fat to reduce and shrink fat. And number two, improves skin quality by tightening the skin, and that can also help improve scarring. So by doing one treatment, we can almost get two benefits. So for someone whose main concern is a double chin plus quality of skin of the neck, this could be a good option too.
Yeah, so Morpheus 8 is basically microneedling plus radiofrequency combined, and it works really well for these indications.
I think that's one treatment that almost covers lots of different things, because if we were to do Morpheus 8, we could use it to improve skin quality from higher up, the transition along the jawline where we can remodel the whole area, and then continue it down, focusing on skin quality lower down. So to summarise, we've spoken about so many different things, whether it's skin laxity and crepiness of skin, the vertical lines, the horizontal lines, and a double chin. All of these things are things that are going to be impacting quality of skin of the neck. Now, your anatomy is bespoke to you, and the best way to think about this is we always try to pick the best option for the patient in front of us. So the most important thing is have a good consultation with a doctor, really understand what your concern is and how a non-surgical treatment could best help you.
So thank you for watching. If you have any questions, please drop them down below, and please remember to like and subscribe.